So now here is the question: why the smoker have always a peptic ulcer, and what is the relation between the lung and stomach? So this is the respiratory tract and respiratory system. Each lung have 10 segments. The left one is smaller than the right one because there is a symmetrical position of heart. The right one is divided into 3 loops and the left one is divided into 2 loops. Now this is the apex of lungs. So superior loop and inferior and middle loops. Fissure is a line which divided the lungs, so horizontal fissure and oblique fissure. The left one have 2 loops, so it is only the oblique fissure. This is the superior and inferior loops. This is the main bronchi, which is further divided into primary, secondary and tertiary bronchioles. Now this is the cardiac notch. Here the heart is present. So this is the cardiac notch. So the lungs contain a lot of alveoli. So alveoli look like this. This is the alveoli which exchange the gas. This is the mucus lining and mucus gland. Now here is the pancreas. Pancreas is made by the cells which is called the islet of lung of hens, also called the pancreatic islet of little masses of the hormone. The pancreas produces 2 types of important hormone. Islet cells act as fuel sensor, secreting insulin and glucagon appropriately during feed and fasting state. Beta cells high level of glucose in the blood stimulate the release of insulin from the beta cells of the islet. Alpha cell glucagon released by the alpha cell of the islet is stimulated by the blood glucose level. The pancreas also produce the bicarbonate. The bicarbonate have important work. Bicarbonate reduce the acidic environment of stomach. So now here is the pancreatic which produce the bicarbonate. Bicarbonate will reduce or neutralize the acidic environment of stomach. Smoke contains a lot of gases. The 33 dangerous gases which are travel in the blood and reach the every part of body where it affect the pancreatic cells. Then the pancreatic cells cannot produce the bicarbonate. So this is why the smoker have always the peptic ulcer. The drugs which we are used for the peptic ulcer, the H2 blocker, proton pump inhibitor, and also use the antacid for the peptic ulcer. So this is the proton pump inhibitor and this is the pivotal cells. This one is the proton pump and potassium pump. This is the bicarbonate and hydrogen ion. The hydrogen ion go out through this pump to a lumen of stomach to bend with the chlorine to form the hydrochloric acid. The proton pump inhibitor block that pump. So now this is the drug of proton pump inhibitor. The omeprazole, esomeprazole, pantoprazole and lansoprazole. Now the H2 blocker. So the pivotal cell have a receptor, the H2 receptor, the histamine receptor, which will promote the hydrochloric acid secretion. So the H2 blocker block that receptor. So the drugs are cimetidine, which is banned because it causes the cancer. Ranitidine, famotidine. This is the H2 blocker. And antacid. The antacid will relieve the heartburn or the stomach pain but cannot stop the secretion or production of hydrochloric acid.